Well, welcome to NTF Live, everyone, and it's my absolute pleasure to welcome Dr. Valerie Grdisa, CEO of the Canadian Nurses Association, as she agrees to share her early career insights and survival tips for nurses, while providing an overview of the role and mandate of CNA. Valerie brings over 30 years of diverse experiences across public, private, not-for-profit, and senior government roles. She's worked in Alberta and Ontario and served in various capacities in 11 of the 13 provinces and territories, including the federal government. Her RN journey career started in 1991 at the Children's Hospital of Michigan, and then she started her NP journey at Stony Brook University in 1998, practicing as an NP serving children and youth, educating NPs and creating both provincial and national NP workforce optimization strategies before transitioning into executive leadership roles across various parts of the healthcare system. Welcome, Val.
Thanks so much, Judy. I'm so delighted to be here and looking forward to engaging in a conversation with all of you.
I'll get the slides going here. And there we go. So Val, I just want to make sure you can advance them yourself. So give that a try.
They're not up yet, Judy. Am I going to see them or?
Okay, hang on a second.
There you go.
They should be up now. My bad.
Okay, so then you're handing it over to me, right? Just that way. Okay, good.
You
I
should
think I'd
advance them now.
okay. I don't know if I can, Judy.
Oh, okay. I can advance them for you, just because I'm not sure why that might not be.
Okay.
So let me go ahead and do that.
Okay.
I want to start before Val gets going to find out kind of who's with us right now. And so I am going to throw up a poll and hope that everybody's able to participate. Okay, great. Thanks. Okay. I'm just looking before I launch the results. I'm just looking at, can you guys see this? What I see? The beginnings of the responses. Can you see that? Val, can you see that?
No.
Yeah, I can. Yeah.
Oh, good. Okay. Then everybody else must be able to see it too. Okay. A few from BC. Oh, that's a nice spread. Missing our Atlantic people.
Well, I only see the first question so far.
Oh, okay. All right.
I think you have to end the poll, maybe.
Yeah. I think that's everyone. So I'll end it. And I'm kind of hoping that can everybody see the responses? Can you see them, Val?
Yeah, I can. It's with the graduate who's in our audience.
I'm sorry. Yeah, we've got one new grad in our audience. That's awesome. And you can kind of get a sense of, can you see that second question as well? The province.
I only see number question. I only see question one, but maybe I'm not. Yeah.
Okay. Well, we've got 70% currently a member of CNA. We have individuals joining us from British Columbia, Saskatchewan, Manitoba, and Ontario. And we have one new graduate, thank you. 3 practicing nurses, that's sweet. A group of nurse educators, and then a couple that identify themselves as others. Okay. All right. Okay, so Val, I think I'm going to have you move ahead with your presentation. We're excited to hear everything that you have to share about the Canadian Nurses Association. And when you want me to move the slides along, you can let me know.
Okay, great. So I think that slides have to come back up. They're not showing on the presentation, on the deck.
Sorry, guys.
Sorry.
Yeah, there's so many, like, I feel like I have to be some sort of air traffic controller to manage sessions. All right, let's share. And now you should be able to see them. So we'll start with
If you can
your,
put it on slideshow, please, so that my slides can show, because I have an animation.
oh, you bet.
Yeah, okay, perfect. So I'll just say next because there's a lot of animation. Okay, so I just wanted to start, this big question mark about really when we think about any one of our journey and what we thought a regulated nurse was, and or a nursing assistant when I was a young kid. And obviously, a lot of our influence was maybe from our personal lives, if we had family members or family friends, and or through the media. And we had the different perceptions of what a regulated nurse is or was at that point in time. I know my grandmother was one, and that really influenced some of my decisions and the way I understood healthcare. So if you can just do a click, it's not to the next slide, just a click. And as individuals, we know that there is that standard definition of nursing, and actually ICN has reached out to all the nursing bodies through CNA to actually reconsider a definition in the year 2025. And I think what's most important for you to know from a CNA perspective, obviously we focus on practice and service excellence, but we also have a huge role in the second paragraph around advocacy, promotion, research, shaping health and nursing policy, and system transformation. Next slide, please. So I just think it's important in the context of CNA, the latest high data showing that there's over 477,000 total nurses across the 4 major types, but we know there might be some duplication across the jurisdiction. So that's an important piece to think about. But when we think about that, when we add the regulated nurses with the students and thinking about our power, that's 500,000 voices we represent in a country of 41 million. So we have a huge voice in our country, and in these current times have an opportunity to drive major decision making. So I know that some of you are in the early stages of your career, and I just wanted to kind of orientate us to the structures of nursing. So when we think about that journey, just you can click and, hey, I think I'm going to be a nurse. What is the next step you have to do? You have to, based on kind of the choices you make, just click please, you would look at, determine, what education program, you're here. So you would be that biopsychosocial spiritual person. So I think it's important for us to know we bring our personal selves into every kind of decision we make in our lives. And if you can click again, and yet we're within this, world and system, and we have all these influences impacting us and determinants that, influence our lives, the lives of those we love, our communities, and then obviously our country. And if you can click again. And then what we've seen in the last generation or two is this, cultural awakening around our responsibilities around truth and reconciliation. CNA's had some major efforts on anti-racism, and there's been, major efforts around really, truly unpacking diversity, equity, inclusion across all sectors around the globe. So if you think about that, when you're making that decision and you're awaiting the academic institution, probably your first foray into the profession, right, is, thinking, what school do I want to go to? What type of nurse do I want to be? Is it, I'm going to go into an LPN RPN program, or is it going to be that I'll go into, try and get into an undergraduate program? So probably the first kind of, sort of touch to the nursing world is education, within the context and within which you live. And if you can click again. But what's really important, click again, is for you to know, and I think none of us know this when we first apply, that although we're probably thinking about, our nursing journey and what school we're attending, right? We also probably now have an understanding that the regulatory bodies actually drive the entry to practice requirements. And there are, at the national level, bodies both for regulation and education. And the ones for regulation are, the Council of Registered Nurses Regulators, the Practical Nurses Regulators, as well as obviously the education associations come together through national bodies like the Council or the Canadian Association of Schools of Nursing, that's CASN. And so they and jointly plan their approach to, curriculum where they see synergies. You can click again. And then, so many of you, when you become a student and at any stage in your career, you might think, hey, I would like to get involved in my National Nursing Association. And CNA, here obviously is focused on advancing professional practice, involved in knowledge creation, dissemination, a real focus on health and nursing policy. We have created the Code of Ethics for decades. We focus on particular issues and try to unpack situations that you're all experiencing, like anti-racism or moral distress in the workplace. We have actual programs that we generate revenue around education, certification, and accreditation. We do a lot of advocacy and lobbying and promotion and member support networking. But it's not just us at CNA that do that. It's actually happens, whether it be in your nursing school society, or whether it be if you join CNSA, or through the specialty nursing associations that exist across the nation, and or the provincial and territorial associations. But today we're going to focus on the national bodies that support the profession. So over its long history, at one point, CASN was actually a member of, was actually part of CNA. It was incorporated in CNA. And as the programs expanded across the nation, CASN became its own corporate entity. But we regularly partner on different strategies, education initiatives, research initiatives that advance the profession. Next slide, please. And then also the three bodies, you can click one more time. The three bodies of nursing or structures, sorry, just to get that box up there, also have synergies. So for instance, with the Code of Ethics, I just actually came off a meeting with all the regulatory bodies where we're looking at ways to uplift and amplify the work and the mandates of each of the national associations. And it's important that, if there's things, so for instance, with certification, the regulatory bodies are only focused on entry to practice, but how can they amplify our efforts around specialty nursing and certification and support that approach, knowing that we too are experts in our fields? The next slide, please. But what's most important, and sometimes it gets left out in the conversation around the structures of nursing, is that every single nurse, and especially in self-employed, employed nurses and students, you can click one more time, they actually, you as a student, you get access to different practice settings, and you start to have a better understanding of the breadth and depth of, of experiences nurses have across the continuum and cross sectors. And I think we're one of the few professions that you can find in every sector almost, especially when you add in occupational health nursing as an example. And, we're impacting people's lives across that work in every single sector. So it's it's really a privileged position we're in to be able to work pretty much anywhere in any part of the Canadian infrastructure. And then I've talked a little, about the professional associations, the regulatory bodies, and the education associations at the national level. But there's, one last structure, especially once you become an employed regulated nurse, that's important to understand its key role. And if you want to do one more click, and that's obviously the union. And the Canadian Federation Nursing Union has its unique role specifically related to collective bargaining, lobbying for workplace conditions, and employee interests. So really, it's the four structures that come together, and where they have synergies, we work together. So for instance, with CFNU, right now, we're co-leading some efforts around nurses' mental health and well-being and psychological safety. And I've mentioned with CASN, we actually have some joint research initiatives going underway. And then with the regulatory bodies, we're working together around the Code of Ethics and certification into the future, just as examples. So we do our best when we think of whatever phase of your career you're at, to really try to advance the infrastructure and fulfill our mandates and support nurses along their career journey. So now Judy's going to have another question for you. So prior to this presentation, I was just curious, were you aware of how the structures support your nursing journey? And there's 4 responses.
I think that's everyone, Val.
There's
so-
8, there's 18, 13 so far. So it really is, you know, when you think about it, the not at all had an inkling in some way is the majority of you. At the moment, that's 11 of 13 that have responded. And so, you know, from my perspective, having been a nurse educator, I think we have some work to do for everybody to understand within the profession how we need to leverage these structures and or understand them and or make sure that they're serving and meeting your needs during your career journey, because it's important for you to understand you are not alone. And that's something in all of the different roles I think I've really tried to focus on in my career, is really trying to understand and network with all of those structures and leverage them and get involved and join my provincial association or my specialty association, or, you know, join the leadership of my specialty association, and obviously have mechanisms to be part of the national voice as well. So I just wanted to reorient us to that. Like when we think about those structures and the fact that all or most of you will be in some type of employment relationship unless you're self-employed or retired. And so we have that 500,000 voices, but I could not go forward, if you could do one click, without highlighting one of the amazing parts of the profession is we have nurses in leadership and executive positions at every level of our health system. In every province or jurisdiction, there are nurses working in the federal, provincial, or territorial governments. Some not as high as we should like. And CNA for decades now has been trying to push for those roles at the, you know, at the ADM level, because really we know that the assistant deputy minister level is the level that can really drive policy and make decisions. We also have, as you know, Dr. Lee Chapman, a role that had disappeared for over a decade, and now she's been serving in it for over a couple of years now. And it's so important that we have a federal nursing voice that represents our perspectives, all 478,000 of us. And then we have to really recognize the efforts of our chief nurse executives, chief nursing officers, in combination with all of the executive nursing leaders across the associations that are coming to work every day, and within the fiscal constraints they might be facing, that they're trying to actually do the right thing for the profession. And, you know, from my perspective, having served as a staff nurse, to a nurse educator, to a nurse manager, all the way up to a chief nurse executive and CEO, it's something, you know, when you've sort of walk through that career ladder of nursing, you understand the privilege and responsibility and accountability nursing leaders have towards ensuring that every generation of new nurses gets the best possible welcome. And I know we have a ways to go, and that sometimes, you know, especially with the pressures now and the nursing workforce shortages, that we feel like we're sometimes on an island, but know that you have a nursing family in all of these different structures within your provinces or territories and nationally that can support you on your journey. So get involved. It's so important. And know that you have chief nurses, whether it be regionally within your organization or like I said, provincially or nationally, that want to hear your voice. And we're happy to in any way elevate it and amplify and uplift it. So who is CNA? I'm going to just do the top of the waves. Obviously, we are the National Nursing Association, we have the national and global professional voice for Canadian nursing. And as the National Nursing Association, that means we are the representative member on the International Council of Nurses, which is really important. There's over 130 countries that are part of ICN. And, you know, we continue to drive decision-making, policy, influence globally, and leveraging and learning from each other. So in becoming a member of CNA, you are part of a global community. We obviously represent all 4 types of nurses, and we have members across all categories, provinces, and territories. And we are working with the nursing associations, some of them relatively new because there's been some structural changes in nursing associations and regulatory bodies to strengthen the affiliation relationships with CNA. So our current mission, our strategic plan with our mission, vision, and values, it lasts from 2023 to 2026. So here's a way to get involved. We are going to be having a strategic planning exercise starting in the second half of this year to really examine, especially within the context of today, what our future state should be for nursing. So it's a really important piece of work we'll be moving forward. But really at this point in time, we are focused on, not only nurses. And it was one thing I said, just so you know, in my job interview, is I'm not a nurse's nurse, I'm a Canadian's nurse. And for me, when I entered this role, it was to actually make a difference and better meet the needs of Canadians and people that access our services and supports. Because I do fundamentally believe that nurses have so much power, and yet sometimes our voice is not heard, and or we are sub-optimized in being part of solutions to better meet the needs of Canadians. Just don't click yet there, sorry, Judy. So the strategic directions at this current state really are around fiscal and operational stability. So associations are membership-based, they're voluntary, and membership is one of the critical revenue sources. So just making sure that we have the right amount of revenue to be able to fulfill our mandate, that we are, providing that strong nursing leadership identity and being that national voice in collaboration with all of the provincial, territorial associations and nursing bodies and employers, engaging in meaningful initiatives and bringing value to our members. It's so important. One of the reasons I really wanted to come to this presentation, and just it's been amazing collaborating with Judy was and Kate, is just around ensuring that we have all nurses' voices at all stages of their career informing policy decisions. And then finally, just ensuring that we provide innovative programs and services, and that we're really lobbying on behalf of really fully optimizing nurses through expansion of practice. So I'm sure you've heard these domains in your journeys: policy, practice, research, and leadership and education. So Judy, this is going to be a quick click, and I'm just going to share with you just quickly so if you could click. For nurses' voices and policy, I'm going to just highlight a couple things in advocacy and nursing policy. For quality and operations excellence, I'll talk a little bit about what we're doing to advance practice and our code of ethics and our certification program called Stellar. Research and knowledge transfer, I'll talk a little bit about our knowledge transfer through the journal and some of the research initiatives. Leadership and impact, I'll talk a little bit about what the Academy of Nursing is and some of our leadership programs. And then education and advanced nursing practice, I'll talk about certification, our program that's been long-standing for over 30 years in professional development. So when we think about nurses' voices, it's important for you to know that right now CNA, and it's usually myself, board members or leadership members, or it could be representatives that are, and I know that Dr. Michelle Acorn's on here. I could reach out to Michelle, which I actually did earlier this month, and say, hey, Health Canada needs some information on that. You're the expert nurse practitioner and nurse practitioner executive for NPAO in Ontario. Can you go sit on that table and provide them with the information they're seeking? So we do have initiatives, over 24 tables that CNA sits on with our interprofessional colleagues. And, one that might be just a quick example is just with all the health workforce shortages, we have a table that's interprofessional, where we're looking at health workforce optimization and retention and recruitment strategies. We also think it's an incredible and one major priority to ensure that based on the feedback from the membership, that everything we do from a policy and advocacy perspective is driven by science and evidence. And I've already mentioned our role at ICN. In terms of policy, you have the typical things you think about, like a position statement or a framework. And I've just listed a couple of examples here related to anti-racism, related to AMS, antimicrobial stewardship. And these have all been released recently. We did a great collaboration with Harm Reduction Nurse Association to put forward a joint statement around harm reduction. And we've had a long history of putting forward position statements and or policy and or getting nationally funded initiatives to push forward advanced practice nursing and to push forward full optimization like nurse prescribing. So here's just a couple if you want to click. We have a CHR grant around racism and discrimination, and the final results will be published this year. We had a highly successful third National Anti-Racism Summit in November, and we had well over 1,000 attendees. And then within even the 1,000 attendees, we had hospitals and other workplace settings having Zoom rooms with 30, 40 nurses. And then here are an example of some recent position statements: the digitally enabled care in a world of advanced technologies and AI. And obviously something that's important to all of us, planetary health. Next slide, please. Here's just some examples of some of the advocacy we do. We have actually communications and media lead who has great relationships with media sources, and you can click again. And we try to get, sometimes they seek us and sometimes we seek out them to have some input into relevant health and nursing policy issues and or issues facing Canadians, which obviously are both. And then we also have meetings in November. We have student representation and board representation of early career nurses, where we have called the Day at the Hill, and we actually meet with all three parties of federal MPs and have discussions about key topics related to their portfolios. In terms of practice and quality and operations excellence, it's so important that we always stay focused on what our main purpose is, which is practice. And the CNA actually brings together all the specialty associations, whether it be mental health, critical care, oncology. There's over 40, but there's 30 that are like actual joined members of what's called the Canadian Network of Nursing Specialties. And we come together 2 or 3 times, well, every 2 or 3 months, and we focus on different initiatives. One of the big ones now too is we have a subgroup focused on specialty nursing practice, and we think it's critically important to really articulate the value of expert nursing and specialization. So we have a proposal that we're co-creating with some of the academic institutions. Our new code of ethics will be released in the winter. So these are all things that advance our practice, or make sure that we have those underpinnings to guide our practice. We have a relatively new program called, if you could go back, you don't have to, this slide's good, called Stellar Certification. And after we saw some of the, really devastating outcomes from COVID-19, especially starting in the long-term care sector, we started a new program that's modeled on the American Nursing Credentialing Center. It's called A Pathway to Excellence. And it really is a focus on making sure that 6 key standards are met, and we've launched it. We've had our first successful Stellar Certification Award, and we've had an additional pilot that's still underway, and we have 10 new sites signing up. So this is about serving nursing in the way of making sure that the environments you're working in actually are focused on 6 key standards that actually support nursing and PSWs and healthcare aides. We also, as the Canadian nurse, I'm not sure if any of you were here at the point in your career when we used to get a paper copy, but we used to get a paper copy and then we went digital back in 2019. But there's actually an article released every single week, and it's submitted by nurses across the nation, and they can have a topic, and we have an editor, and we have an editorial board and with volunteers, and we think it's so important to maintain our voice in a publication like this. And then, although we don't start up research, we are partners. We might be written into CHR grants. We often do letters of support. And then we have a few seminal researchers across the nation that work on specific projects with us right now. It's Dr. Joan Almost and Dr. Peggy White. And I'll be starting up some collaboration with the University of Ottawa to see if we can leverage the capabilities in their research center as well. In terms of leadership and impact, fundamentally, we know that every single day you are serving the needs of your patients and families, or your clients, or your communities, that you are a leader and you're recognized as a leader by the people you serve and by your colleagues. So we know that our undergraduate and diploma-based curriculums do not provide a lot of, theoretical or practical experiences in leadership development, though I know that's shifting. So we have provided for decades a program called Dorothy Wiley Health Leadership Institute, and that one sort of sunsetted over the COVID, just before COVID period. And now we've got a collaboration with the Canadian College of Health Leaders on a particular program called Inspire Nursing. So we're assessing that. And we're also working with the Canadian Academy of Nursing. So this is and actually Dr. Michelle Acorn could pop in if she wanted to and talk about this a little more, but this is a group of individuals. It's again modeled on academies that exist for all professions around the globe that have deep expert knowledge, and they're named fellows. And then we dig deep into that expert knowledge. And right now they're considering some leadership development programs potentially. Like I highlighted, leadership in nursing at every stage of your career is essential, whether it be, having that conversation with your colleague around a practice issue, a policy issue, having that courageous conversation with your patients and families, standing up for high quality care. And then, one of the most important things we can do as associations across the nation is if you are an emerging leader and you want to be able to transition into more formal leadership roles, that we coordinate all of our efforts to enable you to do that, and that we kind of sing from the same songbook about understanding that, when we have workplace settings where potentially 70% of the workforce is nurses, that should be led by nurses whenever possible. Not to say we can't have interprofessional leadership, but we all know that, and the evidence demonstrates that we need nursing leadership where there are huge cohorts of nurses. Obviously, nurses are huge collaborators and push interprofessional care. And I have to say, we are those system thinkers. This is, if you just want to take a second for the QR code, but this is probably more, early to mid-career education opportunity, and for executive leaders as well. That's that pilot program I referred to. You can click. In terms of education and advancing nursing practice, the certification program has been around since 1992. So just when I graduated as an undergrad, actually. And I think it's important for you to know that as a new grad or at any stage in your career, once you feel that you're going into that kind of depth of understanding, knowledge, and skills related to a specialty area, not only do you have specialty associations that can support you, but there's an opportunity to write a specialty exam where you can demonstrate that knowledge, expertise. Right now in the nation, we have 24 specialties and we have 19 exams, and we are trying different approaches. This kind of pilot portfolio base means that some types of nursing specialties, there's not a huge number of them, so it doesn't make sense to co-create an exam. And it's more maybe just to look at their portfolio and their practice and to determine whether or not they are specialists. So we're piloting a couple of those. We also, here, if you can go back, please, I haven't done that other one. The accreditation professional development, CNA oversees the accreditation of education programs that are focused on nursing. So programs that would be provided to nurses to advance their practice or to, increase their depth of knowledge and understanding and skills. And so we think it's critical that it's, a nursing association that's actually accrediting programs. And then I've mentioned the Canadian Network of Nursing Specialties, and there's a typo there I have to fix. And then the Canadian Academy of Nurses, where we are optimizing them in different professional development opportunities. Next slide, please. And it's just important. I think this is, and I actually just had a conversation with regulators about this, and it's so important because even in my time in my career, I would say nursing leaders, nurse executives were much more supportive of recruitment efforts that recognize specialty knowledge and the expertise of nurses in particular fields. And this is something that I'm exploring to make sure that we don't lose this, because we know there's demonstrated impacts and outcomes. Next slide, please. And just as an example, and this is, so we're on a 5-year cycle. Once you get certified, you have to renew or you can write a new exam. And so these are the types of numbers. It's just an example for you to see. And the pass rate is around, 87 to 89%, so just below 90%. And again, those exams are co-created by the specialty nurses for the specialty nurses to get certified. I'll keep going. So what in these early days, and this is actually a slide by one of my board members, who, we've been talking about what is our focus in the here and now. And sometimes, nurses, we are so good at doing so many things. Like we're these systems thinkers and we can have so many priorities going on at once and we can juggle so many balls, but sometimes that's to our detriment. And we have to really narrow in and focus and finish. So we've been having these conversations about focus and finish. What do we need to truly focus on to move the profession forward and to really make sure we're addressing what matters to every single one of you and to Canadians. And so we are deeply involved in the workforce shortages. So, the way it's been described as workforce crisis management, because we know we have shortages, and we also know that we're losing so many of the early career nurses at about the 10-year mark for many different reasons. And we have to create the work environments where you stay. And this takes every single nurse at every single level and every single type of role to take ownership for the environments we're creating for the next generation. Obviously, my goal is for increased visibility and impact and being at all of the right tables. And then also just really making sure that, especially as governments change and we see all these geopolitical situations and kind of, the thinking that's going on around what I'd have to say is freedom of speech and multiple truths and all that, is just making sure that we are up to speed on the evolution of policy and providing the best possible evidence-informed solutions. So that's what nursing needs. And then what needs nursing is obviously just, we do work in one of the most diverse professional populations. And obviously in Canada, we're serving such a diverse population of patients and families. And so just ensuring that we continue to advance the anti-racism efforts we have. And this year we'll be providing an Indigenous anti-racism knowledge sharing event in September, on September 29th, that will be co-led by our Indigenous Relations Action Council. Planetary health is an important policy as well. And, we have to make sure we often have been the recipients of IT solutions that were designed for us, but not with us. And we have to make sure with the digital transformation, including AI, that we are front and center in this transformation that's occurring. Next slide, please. I'm not sure, sorry. Yeah, I didn't realize, sorry, if you could go back. The Nursing Retention Toolkit, if you've not had a chance to review it, I'm sure it's up on the NTF website. It's so critical that we understand that nursing leaders across the nation have come together to make sure that we are implementing the best strategies to retain the workforce. And you could get involved in this. There's multiple initiatives going on across the nation and in your jurisdictions. Next slide, please. So there's another question for you. So prior to this presentation, did you have an in-depth understanding of what CNA is and how it amplifies the power of nurses? Okay, so with 12 answered so far, again, we're seeing some not at all, had an inkling somewhat, and one yes completely. So the majority again are in the somewhat had an inkling. And to be honest, and I'm still only 6 months into the job, there's so many other things I didn't tell you we were doing. So it's a very expansive mandate that we have to ensure that we are representing our profession nationally. So thanks so much for completing that. So I thought I'd just say, and I'm just sorry, I just have the, so what was my journey? I thought it was important for you to understand a little bit about me. And so I wanted to share a tiny bit about myself. So, and I've actually provided this presentation in education settings and to my new colleagues and to the regulators earlier today. And I just wanted, this is the way I conceptualize my career. Is, phase one, which was I was a student, I entered in 1987, and I would say I was in what you would say is the more traditional direct service roles and or education roles. And you can just click once, Judy. And that was kind of that first 12 years of my career. And I worked both as in the hospital and the community. I did have a privilege of during my undergraduate third year to do an RN research fellowship, which actually I do think influenced my my trajectory around knowledge generation. And then as a nurse educator, I was leading a lot of quality improvement. So I always had this deep interest in, like, making a difference and helping my colleagues improve quality. So I called that the thrive stage. And it was really, and at that time I had 2 kids and, moved a couple times and was starting my life journey just to try and, be the best professional nurse. To be honest, and I was lucky I had a teacher as a husband. So I was doing my shift work opposite his schedule most of the time. We didn't have any relatives close by to take care of them. And we had a part-time, in-house babysitter. But it was, it's that difficult first 12 years where you're just trying to get your footings and understand who you are within your profession and how you can make a difference, as well as what you expect from your employer. And, I had the privilege of working in a hospital that saw my potential and provided growth opportunities. That would be Sick Kids in Toronto. And I would say that one experience has probably brought me to where I am today. If I go on to the next phase, lead, if you click down, then I decided, all of these colleagues around me, including Dr. Acorn, I had this kind of early group of nurse practitioners, and I was really jazzed by the role. So I actually saw education south of the border in Stony Brook, Long Island, and became what at that point was a clinical nurse specialist nurse practitioner program focused on children and also just generalists. You have to do both, the specialty and the generalist at that point in time. And I had 2 nurse practitioner roles, one in an inpatient setting and one in an ambulatory setting. And so again, once you get that graduate education and you realize the expanded scope, and I worked with a physician team of 9 docs and then 4 docs, and it was an incredible experience. I got quite involved in my professional association at the time. MINIG is the Mental Health Nurses Interest Group. I was working in children and youth services and predominantly with street kids and mental health issues, and was even a child welfare nurse where I did abuse investigations in downtown Toronto. It was quite an intense period, but a huge professional growth period. When I did my master's degree at that point, there wasn't much regulatory frameworks around nurse practitioners. So I actually did a placement with the then Chief Nursing Officer of Ontario, Dr. Kathleen McMillan. And literally, just for you to know, if you're thinking about staging your career, I literally emailed Kathleen. I didn't know her, threw a hole in the ground and said, "Hey, Kathleen, I want to be a nurse practitioner and they're barely evolved here in Ontario. Can I come in and do a policy placement with you? Because my faculty has agreed that I could switch a practice placement to a policy placement to better understand how I can, influence NP role integration in the nation or in the province." And so she took me on and I had a 6-month placement with her. And man, oh man, did that open my eyes around decisions and how they're made in government. After that, I became the director of the nurse practitioner programs at U of T, because again, and I always joke, and I'm not meaning to diminish myself, that I was a last resort, but there were so few of us nurse practitioners that had graduate education. And so when there was a vacancy, I put my name in the hat, and I luckily, achieved being selected as the candidate. And then I started my PhD dissertation, and I kind of pivoted to health services and policy research, and I focused on measuring integration for intersectoral services for children and youth, because that's what my nurse practitioner and RN practice was about seeing kids fall between the cracks or not be identified earlier before they had devastating impacts or consequences. And I really wanted to better understand that from a research perspective. So that was my lead phase. And then I went into this transform phase. So I took my PhD, I actually got it copyrighted, and I did something very few nurses do. I joke, I went to the dark side and I went to private sector, and I became the director of the health practice for one of the big 4 firms. And I was leading, and I led over $50 million in projects where I was actually leading projects around transformation of health systems across the nation. And that's how I got to know Canada in ways I couldn't anticipate. And I always say it's unfortunate that, I had to go to private sector and kind of sell my ideas to be listened to. And it was not something I could really live with. And during one of my placements or one of my major projects, I got to know the government of Alberta, and the deputy minister at the time created a new position that was a senior nursing advisor at the ADM level. And I put my name in the hat, and because they'd known me through the results-based budgeting project I was doing, they chose me. And that changed my life forevermore, to see how governments make decisions about nursing policy and nursing workforce. I also I did some work with, the Federal Provincial Territorial Nursing Advisory Group. After that, my family was sick of me being out west and my kids were still in school. So I went back to Ontario and I worked in RNAO and oversaw their best practice guidelines program and was more focused internationally. And then I decided that I wanted to go back to practice. I call it a jungle gym career where I either get bored or I get tapped on the shoulder, or I see an opportunity and I decided to go back to that role. So that's my transform. Like I was trying to make a difference, trying to change things, trying to use my knowledge, expertise to influence policy. And then finally, at this stage in my career, I call it the summit phase. For the last 5.5 years, I've served 5 years, I've served as a CEO in a healthcare organization up until this summer, and now as the CEO at CNA. And, one of the reasons I came back after serving in a direct service CEO role was just to try and make, a difference for my profession now. Actually, in my mind, it's almost like the summit means that, bringing all of those experiences together to see if I can leverage the knowledge I have to ensure that our voices are heard where we should be at all times and at all tables. Next slide, please. So I would be remiss not to say to you that, so if you are at all considering it, you've heard all of the things that I've highlighted, and there's many more ways to get engaged and join networks. This is our current pricing, but because you're here today, I am offering to any of you that fit into that general member category a $50 discount. And Judy will provide your names if you're not already a CNA member. And if there were any new that joined that were student members, it would be a full 100% discount, because 50 minus 20 or 25 minus 50 is 0. So just for you to know, if you're not there, for you to get engaged and to try CNAO, I hope that you really consider joining, and I'm always here to answer more questions. And so I just wanted to highlight, and Kate and Judy have been incredible colleagues. She reached out to me and we've been chatting, and I can't think of a more important group of nurses to talk about than those in the earlier stages of their career or providing direct care. It is you that actually is making us be that most trusted profession in the nation. It is you that is serving people with complex and diverse needs, and sometimes people with very fragile, whether it be, biological chemistries or conditions. And I just want to thank you. And it's been a true privilege to present to you today. And now we're here to open up to any questions.
So Val, there is a question that came a bit earlier about specific resources or educational opportunities for new grads with aspirations to start developing their leadership capacity, and eventually, so maybe more kind of starting out with your informal leadership capacity building and then leading to more formal leadership positions as they get more experience. Are there resources through CNA that we could offer our new
Yeah,
grads?
there are. And to be honest, we have Dr. Joan Almas going in and sort of updating the leadership it's like a inventory of leadership development opportunities. But if I take a step back around leadership, I want you to know, and especially when we think of the people we serve, you are already a leader, right? You are in this very intimate relationship with your patients, families, and your communities, communicating with people at moments in time that none of them could have anticipated, right? And so one of my biggest pieces of advice to you is get involved. I'm pitching CNA today as a collaboration with NTF, but if I think about what influenced me, like I joined the RN Food Board in Ontario, which was the Registered Nurses Foundation of Ontario. And I met like nursing leaders' names who are all in textbooks through that. And I don't know why I did it, to be honest. I was like 27 years old and I'm like, I'm joining this. They just seem like a cool group of board members. I also, like if you like someone, if you like a nursing leader and you go, this person just jazzes me up, they make me feel good, they provide insights, they help me reframe things, whatever it is, let them know and see if you can engage in a formal or informal mentorship relationship. I know there's tensions across the profession right now around formal leaders and how they are or aren't supporting you. And I don't know, I guess because I've served in all roles and I know so many nursing leaders, I fundamentally believe that most of these nursing leaders are committed to doing the right thing. but they have so many pressures and constraints, and especially the budgetary constraints. And that's why we need our fully synergized and unified voices, because there's not another profession that is tolerating what we're tolerating in terms of, maybe it is like the nurse patient ratio. And I remember saying to my staff when I was a manager, you have to write all of the quality and safety incident reports, because it gives me the evidence to provide the argument that we don't have the right staffing model. And I think that this is something that I really want to focus on, is that kind of early to mid-career formal leader and informal leader, that we give them the tools and the capabilities, and we bolster the courage they have to actually advocate on behalf of patients and families.
Oh, thanks, Val. That's wonderful. Appreciate that response. There is someone who's interested to know more about the shift to replace the code of ethics with the code of conduct. There are documents being presented to nurses in a variety of provinces. This individual is from Saskatchewan, where they're drafting a code of conduct and asking for feedback. What are your thoughts on that direction?
So the code of ethics is kind of, and I'm sure all of you at some point in your training sort of took the kind of the ethical underpinnings, right, in healthcare. So the code of ethics is the highest umbrella that's truly based on the theoretical framework of ethical decision making. And you're right, like even me now refocusing on our profession, I am seeing that some of the regulatory bodies are either creating their own code of ethics or they're focused on code of conduct. Code of conduct is way narrower. And we have engaged the regulatory bodies, and I raised it again today, to make sure that those core ethical principles, which are, key to our kind of understanding of and our way of being as professionals, are not lost in kind of the mandate of protecting the public. The ethical principles is what like sort of serves us as our foundation, versus a code of conduct really is kind of like a standard of behavior. And these are the conversations I'm starting to have with the regulatory body, because I don't think we've had those difficult conversations about how we are, in my mind, somewhat confusing the profession. And so honestly, with that question in mind, you probably have my contact information. I'm not sure it was on the presentation, but you can easily contact me. We will be releasing the Code of Ethics in the next month or so. We're just doing French translation and a few minor editing. And so when you read it, and then hopefully when you see the Code of Conduct, you'll be able to clearly differentiate that one is about the ethical, philosophical underpinnings of the profession and what guides us in our decision making, versus one's more about expected behaviors.
Yeah, thanks, Val. One individual is asking if you have any plans for advancing or enhancing the range of certificates for RPNs in the future.
So that's a great question. And so right now there's only two, as I was highlighting in the presentation. And I'm actually the credentialing director. Her name is Misty Fortier. She's this wonderful woman. We've been having conversations about that. And it's not that we don't want to do it. It really is about bandwidth or like our capacity to do it. Because when you have a certification exam, it's actually co-created with the nursing experts. So what we would need to do, whether it be that we have like a 2.0 version of a particular specialty, we would have to either bring LPNs or RPNs together to co-create, or it'll be a whole new process with RNs and LPNs if we're not differentiating in the specialty area. So I actually just talked to the regulatory bodies about this. We need to have an open conversation amongst nursing, especially as regulation is differentiating, say, RPNs or LPNs to RNs more from education. And we all know that your entry to practice degree or diploma does not define your expertise and experience as you grow in nursing, and that you do become specialists regardless of which type of role you're in, all four of them. I mean, obviously RPN as in psychiatric is, deeper in that, but then they might become experts, say, in a specific age population or a specific type of mental health condition, or in collaboration with substance use problems and harm reduction. So these are the conversations I'm just starting to have. And we have put in a CIHR grant, so the Canadian Institute of Health Research, to evaluate the impact of specialty certification here in Canada.
Yes, and along the lines of interest groups, are there mental health interest groups at the national level?
Yeah, so there's the Canadian Federation of Mental Health Nurses, and they are part of that CNNS, the Canadian Network of Nursing Specialties. And actually, Sarah, who's the CEO at our ED right now, her and I are working with CFNU. So it's actually a collaborative, all three organizations, the Canadian Federation, CNA, and CFNU, to start a mental health and kind of wellness curriculum for nurses. That's going to be three events over, probably it's going to be April, May, June. And yes, so they are kind of the focus on mental health, but then there's also the Harm Reduction Nurse Association, which again has a mental health overlay, but is more focused on the harms involving substances.
And I think there's just one last question, and that is CNA membership open to nurses practicing outside of Canada for training and education?
Yeah, you have to, yeah, you can join. It doesn't matter what your practice environment is. If you're working internationally or being educated internationally, yes, you can join.
Okay, great, thanks. And one other comment here, someone has noticed that some schools have removed some certificates for nurses. Is CNA a part of that?
So CASN, that's that structure I introduced way back at the beginning. They have specialty certificates. So there's almost like, if you think of credentialing, you go to an education program and you get a certificate. What I'm talking about, certification, is an exam that demonstrates your expertise and specialty knowledge in one of those 24 specialties. So that's different than a certificate. So a certificate really is acknowledging maybe some knowledge and like development over maybe a time-intensive period. So that would be CASN making those decisions if they're actually ending certain certificate programs.
Right, thanks for that distinction, Val. There are no other questions unless anybody wants to put their hand up. We are approaching our hour. Oh my goodness, Val, this was so incredible. I learned so much about CNA, and I thought I had a sense of what CNA was all about, but I sure hope that everybody gets a chance to see this when we post it on the website, because I learned so much. I'm so grateful, Val, that you have taken on this huge undertaking to regroup with CNA. I can't imagine everything that you are responsible for or engaged in. It's a privilege for NTF to be working with CNA. And thanks for that information about your journey. It's always fun to see how different leaders come to their positions. And I know that there are several students in the group, and I'm sure that they really appreciate that perspective, right? Because I think we should be somewhere way ahead of when we ought to be there. And there's so much learning to occur along the way. It's all about the journey for those students and new grads out there. So we will be posting recording of the session. I did put a note in the chat, so go to the top of the chat, and there's a link there that allows you to do an evaluation of the session. And there is an opportunity in the evaluation to share your email, and you'll be put in for a draw for some NTF really sweet swag. So you don't want to miss that. I think that was everything that I wanted to say, Val. Just so much gratitude going out to you for the work that you're doing and for taking the time to share it with us today. And I am pleased that everyone joined. Thank you, because we know everyone's time is really limited. So wishing everyone the best, and thanks again, Val.
Thanks so much.